my name is Erin Backing and my instructor is Tammy DeWitt. I'm doing a presentation on proper body mechanics and ergonomics. Did you know that 80% of nurses work with musculoskeletal pain? 24% of nurses and nurses' aides reported switching shifts or taking sick days to recover from unreported injuries. So what are proper body mechanics? Proper body mechanics are using the correct muscles and posture to complete a task safely and efficiently. So when do we need to use proper body mechanics? Always. That includes bending, lifting, patient transfer, among other things. And this includes our daily activities. So when we're bending, is the man on the left or the right doing it correctly? That is correct. The man on the right is bending down properly. If you bend down like the man on the left, you are going to end up hurting your back. So bending and lifting go together because first you have to bend to pick up the item and then lift. So I'm going to kind of demonstrate that. So with lifting, first thing you do is you center your body over the object you're going to be picking up. Your legs are about hip width apart. You keep your back straight, your head straight ahead. You tighten your abdominal muscles and you bend at your legs. So you bend down, you pick up your item, and you keep your back straight the entire time. You keep your object close to your body when moving. So you can walk forward, or if you need to turn, do not twist like this. That is going to hurt your back as well. You need to slowly pivot if you need to turn. And then the same body mechanics as you lower the item. Okay, patient transfer and lifting is going to be the same as picking up an object, only we're not picking up a patient from the floor. If you're doing that, you should be using multiple care workers or a lift of some sort. So you see as she's picking her off of the bed, so her legs straight, knees bent, back straight, grab around the patient and lift with your legs. The bed and chair height need to be repositioned to working height, which would be at waist level. It is a very important thing to do, as I have found out. I am one that I forget often to adjust the table of the patient before I start doing a dressing change. And halfway through taking off a dressing or wrapping somebody, I realize my back is hurting, and sometimes the dressings can be a long time and it's cramping up. So it's better to start ahead instead of doing it halfway through because you're already sterile at that point. In the last couple months, thankfully, I have been better at raising the bed before I start working. Okay, so then do you want to push or pull a cart of any sort? That's right, you want to push. Why do we want to push? We want to push because we can maintain our proper body alignment when we push. If we're pulling something behind our back, so our arm is twisted and our body is not in alignment. Whereas if we're pushing an item, we can push and keep our head straight, our body straight, and our spine straight, and use our force to push the weight. You also want to push between your waist and your chest height. So you don't want to be pushing above your head or way down because then you're bending and you're walking kind of silly. Standing is also an important thing. How many of you slouch? I do. I find myself all the time when I'm sitting or standing that I kind of slouch over, and I could probably doing it right now. So the proper way to stand is keep your feet wide, about 12 inches apart, your back straight, your shoulders down, and your chest out, head forward. And that's how you should stand. It's also important to have proper shoes with good support and low heels. So some risk factors according to OSHA are force, repetition, and awkward postures. Force is the amount of physical effort required to perform a task, such as heavy lifting. Awkward postures are assuming positions that place stress on the body. So this would be leaning over a bed or a chair. You're putting a blood pressure cuff on, stand on that side. Don't lean over the patient and do that because then you're putting strain on your back. Common injuries include lower back pain, sciatica, rotator cuff, epicondylitis, and carpal tunnel syndrome. So how do you avoid injury in your everyday life? So any task you're going to do, just remember maintain. You want to maintain your proper body alignment. Maintain a stable center of gravity. Maintain the line of gravity, and maintain a strong base of support. Ergonomics also goes along with proper body alignment. So ergonomics is a workstation and use of appropriate equipment used to prevent work-related injuries and to promote work efficiency. So the next photo I have here is sitting. So we're gonna do sitting, and then we'll add a computer in this. So sitting, you wanna sit upright. You want your head facing forward, your support on your lower back. Keep your shoulders relaxed and your back straight. Keep your hips level with your knees, and your feet should be level on the floor. If your feet do not go level on the floor because of the height of the desk, you may use a footstool as well. So now adding a computer on top of that, you want the top of the monitor to be level with your eyes. You want your elbows close to your body at a 90 to 100 degree angle. You want your wrist in a straight line with your forearm. So notice how there's no slouching or leaning over in this photo. Slouching and leaning over cause stress to the lower back, in turn causing back injuries. So some equipment used in the healthcare field, this is a sit to stand lift here. That is used when a patient can't bear weight and you don't want to be holding the whole weight of the patient. You always want to have two healthcare workers to run a sit to stand. And the same with the Hoyer lift. That's if there's non-weight bearing or the patient cannot move, and that prevents tearing sometimes when you're doing a bed change or moving over to a stretcher. Some other equipment that is also used, you'd have a gait belt, which allows you to lift a patient up and have a handle while keeping proper body mechanics going. And there's also different things in the office, such as a back support, wrist support. There's multiple things that you can do. So also, I know at Spectrum Health they do this, and I think at a lot of workplaces they have an ergonomics coordinator come, and they can evaluate how you are sitting, how you're doing your daily job, and they can suggest different devices, whether that's a back support, a wrist support, or what have you, so that you can make sure to be efficient and proper in your workplace. I have a couple of cartoons here. Wow, Crystal, was that cracking on your spine or Mr. Bigley's shoulders? And the other one is Kate suddenly wished she had not told Mrs. Ivy to hold on quite so tight. And these are just to remind you that proper body mechanics and ergonomics is not only important for you and your coworkers, but it is also very important for your patients. And here is my source citations, and then I also have all the photo citations here. So if you have any questions, leave some comments below and I will be sure to get back with you. Thank you.